Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. He's back, Dr. Geoffrey Mt. Varner. We talked about a lot of things last time, and I told you I would bring you back so that we could discuss medical marijuana, or just marijuana in general. Welcome.
Thank you for having me. Thank you.
Now, we know that marijuana is legal in many states, District of Columbia. What's the difference between medical marijuana and the marijuana you buy on the streets?
That's a very good question. And let's put them in two categories. Let's say medical and legal marijuana. Let's put them in the same
Okay.
category. And the marijuana you buy on the streets. For the medical legal marijuana, there's a standard for it, meaning that there's certain additives that are not allowed. There's someone overseeing it. And so if you get that marijuana, you know that there won't be any extra stuff put in, such as tack powder or fentanyl. That's a quote, safe marijuana. Whereas on the street, Uncle Bubba can grow it, and if he wants to increase the amount of it, he can put whatever he wants in there. It's an unregulated type of marijuana. In general, it's likely unsafe, because that person's goal for the street level is to create as much as he can to make as much profit as possible.
So is the marijuana that was smoked in the 70s and 80s, is it the same marijuana that we're getting now? What's the difference between, I know one of the difference, the smell. What's the difference between the old school marijuana and today's marijuana?
I love how you frame that, old school. Old school marijuana, 70s and 80s. In general, that was more natural. The amount of THC, that's the psychoactive component, it was about anywhere from 3 to 7%. In today's weed, the legal marijuana, it has up to 90% THC. That's the psychoactive. Not only that, today's marijuana legal, it's engineered. When people say natural, they're saying because it was grown out of the ground, but the seeds that they were grown for, it's engineered. It's a humongous difference. It's not the same product.
Does one get you more high than the other?
Absolutely. Defining the old school weed compared to now, yes. The weed today, with the increased amount of THC, the psychoactive one, it gets you, quote, more high and has more side effects because of the active ingredients of the THC, the concentration of it.
What are the side effects?
The side effects are many and multiple. Let's just talk about the heart. THC causes an increase in your heart rate, increase in your blood pressure, and it can cause a disruption in how your heart beats, which is why the first hour after smoking weed, you are at increased likelihood, you have a 5 times increase likelihood of having a heart attack for that first hour. That tells you something about it. If we move from the heart just to the neuro component of it, you have more difficulty gathering your thoughts. You have memory loss. The short and long-term effects of the old weed versus today's weed are vastly different.
You hear a lot about medical marijuana and its benefits for people, for example, who suffer from fibromyalgia, things like that, where you're in constant pain. Are there benefits to it? You just spoke of some of the negatives. Is that a benefit?
It is.
For pain control?
It is. And being a practicing emergency medicine doc for over 30 years, I've seen the benefits. I've studied it. For people with chronic pain, it's very helpful. Especially people with chronic pain who are enduring cancer. People have a problem with nausea and vomiting. It's been shown to help with that. And people with seizure disorders. It's been shown to help with that as well. So there's definitely a positive benefit when used appropriately.
What is the appropriate use? Let's just say you're using it for a medical condition. Is it once a day, or how much is good and how much is too much?
It depends on you and your doctor. Because keep in mind, marijuana is a drug. Drugs are dose dependent. If you're getting the medical marijuana, they know how much THC is in there. And so therefore, they know how much to tell you to intake. And so you know that you're not taking too much. And yes, it matters the dose, especially with the condition that you're treating.
You know, back in the day, back in the 90s, so many of our young men ended up going to prison for these small marijuana offenses. Now we've got big businessmen making millions off of the same industry. And it's sad in one sense, the fact that so many people had to spend time and will be permanently damaged as far as their ability to get jobs and live a normal life. And then on the other side, these people are just profiting. Do you see that as well?
I see that. And let's add to it. There are young men in jail right now who are in jail for weed offenses that happened prior to weed becoming legalized. And so what I see is disparate treatment. And not only that, with the legalization of weed, what we're finding is that most of the time it's not black folks owning any part of it. And that creates an issue. And while you didn't ask me this, I would say this: if I am a black male, especially young black males, I would not allow weed to be one of the issues that I face. Because keep in mind, as you just talked about, we still have an illegal market and we still have a legal market. And it's not legal in all states. And so by you just choosing to use weed and you happen to go into one of those states where it's illegal, you are putting your future at risk.
How does your brain handle weed? Let's just say the 19-year-old, how a 19-year-old brain deals with it opposed to a 30-year-old. What are the differences in the way the body processes it? We do know that a young man at 17, his brain is not fully developed, where a 30-year-old is.
Your brain's not fully developed till you're 26 and 27. Studies are quite clear. If you introduce weed, THC, to your brain prior to that age, you're more likely to develop cognitive delays, memory difficulty, anxiety, and stress-related issues overall. Hence, if you are going to smoke weed, wait till you're over 26 or 27-year-old, because your brain is fully developed. And you don't see the severity of it with those who are over the age of 30 who start to use weed.
That's a hard nut to crack when it's so prevalent nowadays in high schools, in colleges, everywhere you go. I mean, every time I get to the DC line, you smell weed.
Everywhere.
You smell weed everywhere. How do we get out the message?
I think it's going to be a community effort. That weed, it's a it is a drug, and some people will say, but it's natural, and therefore it's okay.
Yep.
Well, guess what? Cocaine is natural. That's not okay. Rid yourself of thinking that because it's natural, it is safe. It still has a psychoactive ingredient, something that will disrupt how you think. It still has that ingredient in it. And if you would like a successful future, if you want to make sure you're on that ladder, it's very important not to do anything that disrupts how fast you think, how fast you make decisions, because weed disrupts that.
Do you think that marijuana, and I've had this debate with my children for years, do you see it as a gateway drug?
It's not that simple, but the long and short answer is yes, especially today's weed, because today's weed has that psychoactive piece, and it's more concentrated, and therefore your brain starts to adjust, and it needs more to get that feeling. And to get that feeling, you like tend to go into other areas. And keep in mind also, it's not just the effect of weed, it's how weed makes you feel, and therefore what you do. Because when you're under the full effect of weed, you're disinhibited, and therefore you're more likely to try something else.
Do we have any studies at this point on the long-term use? Let's just say if you started smoking weed as a teenager and you're now in your 40s or 50s. Any studies on the long-term use and how it could impact your future?
The current studies are showing that people who smoke weed, especially earlier in life, are about 26% more likely to have anxiety issues. 2, they have difficulty handling stress. 3, they have cardiovascular issues as a result of the chronic effects of smoking weed. And if you add the psychological piece to it, if you already have a predisposition to a psychiatric issue, weed can make it more likely.
You know what? Everything you've just said, that's why I love the things you do. I love what you post on Facebook, and I love talking to you, because I thought it was the complete opposite. I thought that marijuana would help with the anxiety, that because of its calming effect.
You're not wrong. We talked about earlier that marijuana is a medication which has a dose. Early on, it will make you feel calm. But once you reach a certain level, it increases anxiety. It increases stress. Now, here's the million-dollar question. Is it the first puff, the second puff, or the third puff that the calming effect wears off and it increases the anxiety? We don't know. And if you're buying street weed, we don't know how much THC is really in there. Let's add on there. If you're buying legal weed, are you getting the weed that has 30% THC or the weed that has 90% THC? And so therefore, you're really gambling. You don't know how much weed you are really getting. I mean, how much THC you are really getting in that weed.
And of course you were talking about the street weed, and how people have died, many people have died because of how sometimes things are mixed in there, that you don't know. You're taking a gamble with your life. And let's talk about things like fentanyl that can be mixed into whatever, and next thing you know, you ain't here no more.
That is very true. I have taken care of several patients who have died from smoking weed, and it was the weed that was mixed with something. But there's another category of people who they smoke weed, it was mixed with something, and they never made it back to normal. They never made it back to their normal mental baseline. And therefore, smoking street weed, you are really saying, hey, person I don't know, I'm going to trust you 100%. I'm going to buy the weed from you. And by the way, because it comes in an inhaled version, it has immediate access to your brain and to your heart. And you're trusting someone who you don't know with your life. And I ask folks, what kind of sense does that make?
Doc, what kind of precautions should you take if you're going to do this? Or as a father, as a medical professional, what would you tell folks who say, now that this stuff is legal, if you say, I'm going to do this, what should you be careful of?
A few things. Number one, while the weed industry, the legal weed industry, is not owned by black folks, there's still a governing body. So therefore, if you're going to do weed, I recommend you use the legal weed. Number two, be very careful about edibles. People use the edibles.
Let's talk about the edibles.
What ends up happening, I see more of my overdoses with edibles.
Really?
Yes, because if you smoke weed, because it goes right to your blood-brain barrier, so you feel the effects right away, within 5 to 10 minutes, probably quicker. But with edibles, it takes about 30 minutes. What ends up happening is somebody give you an edible. I feel fine. Let me try another one. I feel fine. let me try another one. And you've already taken too much. And by the time it all kicks in, you've overdosed. And that's why edibles are very dangerous as well. That is what we see in the ER a lot, of the overdosing of the edibles.
And exact for people who don't know, what exactly is an edible?
Edible is, to put it very broadly, any food, any gummy that you have that they put weed in it. It can be a brownie. It can be a gummy. Those are all in the edibles category.
And you don't know what the dosage.
You don't know what the dosage is at all.
And of course, they're very, very, very popular.
And they're very good at times too. And so you're taking it, it tastes good, you're not getting the effects, you're not getting the effects because you're thinking, I don't know how much weed is in this. I don't know how much THC, I need more. And that's where you run into problems.
Oh, it's you got this brownie and it's tasty, and you're like, give me another one. Give me some milk to go along.
Exactly. And so it's a double-edged sword. And you often hear people who are older say, well, when I smoked weed, I did fine. Look at me now. If there's anything people learn from your show today, today's weed is not the same as yesterday's weed. They're two completely different products.
Wow. So what is the impact? We've talked about some of the physical impacts. Let's talk about the lungs. We talk about how vaping is terrible for your lungs, and they're learning more. It seems like more and more information is coming out every day about how this is impacting your lungs. How do things like marijuana, if you smoke it, how is that impacting your lungs?
Marijuana, it's still an irritant to your lungs. And therefore, the same effects that you get from smoking even cigarettes, they're going to happen. It may not be as fast, but you're irritating your lung. You're creating inflammation. Inflammation is a precursor to any type of cancer. So you're chronically irritating your lung. And so often you're going to develop restrictive airway disease. Simply, your lungs do not function as well. And therefore, there is a long-term impact to smoking weed. And by the way, people are vaping weed as well. So it becomes a double whammy.
Wow. How do you vape weed?
Well, they have these little vape pens. And it's very interesting. The vape pens don't have the smell. I was recently someplace, and the person pulled out the vape pen, and they vaped, and I could smell weed. I said, "What is that?" I said, "Oh, it is just weed," but it was so fast. I was amazed because they're able to do it just any place. It's a little more expensive, but there are vape pens available now.
What do you think about states legalizing marijuana opposed to there being a federal legalization? And are you in favor of the legalization at all, if that's not too personal for me to ask you?
I'm answering in two ways. I am not in favor of it. I'm not in favor of it because of the long-term effects of weed and because it's not regulated well. And what we're seeing from the medical world is that people are experiencing what we call cannabinoid syndrome now, which is basically you've developed an addiction to weed. And
I thought you couldn't.
That's what we're taught. But no, the DCMM6, which is the diagnosis that psychiatrists use, it is now a diagnosis. And so you can develop an addiction to weed. Back to your original question. I am not in favor. However, as long as it's legalized, I would prefer for the federal government to legalize it as well. Here's why. As long as it's at a state level, you don't have access to business funds. And so therefore, if you want to get involved in the weed market, you've got to have cash. And because of many things that have happened in the past, black communities don't have access to that kind of cash, which is why the states where it's legal now, 97% of it is controlled by non-black folks. By federally legalizing it, then you can get loans and we can enter into that market.
Do you think we could make our way into that market? Will we be allowed in?
Well, there are a few weed growers that I know who are in it, who are black. And similar to alcohol, we'll be able to make our way in, but probably not as fast as the first people who jumped in there. But there's always a way.
Do you see in the future the federalization?
I do, because I do mainly because of where the country's going. Many states are starting to adopt the legalization of weed, and therefore the federal government at some point is going to get involved. And once the federal government gets involved, it becomes even more regulated, which in this case is a good thing.
How does it work when you go to an establishment that sells weed? Do you have to have, see this is how naive I am, do you have to have a prescription, or can you just walk in and buy what you want? How does that work?
Depending on what state it is, if it's legal, all you have to have is an ID and you have to have cash. Because it is because it's not legalized yet, it's a cash business now. And therefore you pay in cash, and you have to show that you're a certain age, and you can buy what it is that you choose to.
But I guess I'm confused at the prescription. If you have a prescription, you present the prescription, or how does that work?
Well, if you have a prescription, there are certain pharmacies that are set up for prescription marijuana.
Okay, that's not the store that you go in.
Right. Now that store may have a dual role. They may have it set up for that as well.
Okay.
Yes.
Okay. And so you can do both.
Yes. And usually there's a regular primary care doctors often don't write that script. You usually have to go to a pain specialist.
That was exactly what I was going to ask you. What type of doctor would recommend that? Does it have to be a pain specialist? Is it just your gynecologist? I mean, who's going to write that prescription?
It's usually a doctor who has specialized training. It may be your naturopathic doctors. It may be your primary care doctor who's gone through that extra training. And so it just depends. But usually they have had additional training because of the additional scrutiny that comes along with writing a script for that.
If you're smoking marijuana because you feel that it's natural, and you say it's not natural, what is the most natural way to get this product?
The most natural way?
Yeah, if now all you're getting is manufactured, there's no more natural marijuana unless you buy the street marijuana.
Right, unless you buy the street marijuana, they will present the manufactured one as natural, but it's been engineered. So they'll use it natural, but the safest way is to buy the engineered marijuana.
Now, you gave me an example before we got on air. We chatted a little bit, and you said it's just like seedless grapes or seedless watermelon.
Right. View today's weed as engineered, meaning, for instance, if you go to the store and you see seedless grapes, for instance, just know that's engineered. It's been engineered to take the seeds out, because naturally, grapes have seeds. It's the same with the marijuana, that it's been engineered, meaning it's been altered. Someone has played with its DNA, and therefore it's, quote, not natural. Comes out the ground, and therefore they think it is natural, but it was engineered before it even went into the ground.
What do you have to say to parents whose children are smoking marijuana and they don't like it? What warnings should we give our kids? What should we say to them? Especially you got a college kid, they're used to being on their own, they're going to do what they do. It's like, son or daughter, be safe.
Yeah, it's not simple, because you're right. They're in college, so many people are doing it, but a few things that I would recommend, especially during the summertime while your kids are home. Go to your primary care doctor, get a script for Narcan. Narcan, it is the medication that if there's an overdose, you give it to them and you can save their life.
What does that Narcan do to bring you back?
If the overdose is just due to weed alone, Narcan will do nothing.
Oh.
Right. However, because what we just talked about, often weed is laced with something. If that weed has been laced with an opioid, you give them that like Narcan, it reverses the effect of of the opioid in there right away. Secondly, one of the side effects of smoking weed is intractable vomiting. It's called hypercannabinoidemesis syndrome. In other words, you vomit so much, nothing can control that vomit. Often when these patients come to the ER, they're there for several hours, they get several liters of fluids. Many times I've admitted them to the ICU. In fact, what we do in emergency medicine now, when these young people come in with nausea and vomiting, we used to think it was gastroenteritis. 5 years ago, we would not do a tox screen on them. Now we do a tox screen. Because often we find out, okay, they've been smoking weed, and it causes us to treat them more aggressively. If you find that your child is nauseous and vomiting, they could be smoking weed. 3, it's so pervasive that it has to be a discussion between you and your child. It's not one of those times where you can just say, don't do it, because chances are when they would leave your house, it's so available. You've got to create some rules, some understanding, and most importantly, just tell your child, hey, if you're going to smoke weed, wait till your brain's fully developed. Weed's going to be here. Wait till you're 26, 27-year-old. Then you know it won't have as much long-term impact.
Dr. Geoffrey Mt. Varner, it's always a pleasure
It's my pleasure.
talking to you. And also want to let everybody know that you do different tips. Tell
Yes.
us about that.
Yep. I do a lot of medical tips as it relates to care and health overall. They can mainly follow me on Instagram at Dr. That's Dr. Geoffrey, Geoffrey MPH. And on Facebook I do as well at Geoffrey Mt. Varner. For instance, June's coming up. I'll do a full month of men's health, prostate screening, high blood pressure, just a lot of robust tips about decisions that we make about our health.
And I'm a tip lover. I love getting little medical tips. As a matter of fact, when I go home, I'm going to watch your tip on drinking milk. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Enjoy the rest of your day.